Good morning. Thanks very much for the opportunity to speak today to the Parliament of Canada and their representatives. A special thank you to Dr. Kirsty Duncan, who's been a powerful advocate for those of us with CCSVI and those of us within that have multiple sclerosis. I have multiple sclerosis, was diagnosed in 1996, lost my career in clinical anesthesiology. Prior to that, I had been an academic anesthesiologist and had done research particularly on brain function and then also on stroke research. Stroke research is a particularly important piece because it may be the stroke neurologists that accept this best among the neurologists and then incorporate that belief system to work with the other people that are also extremely important in brain function and brain treatment. And that would include anesthesiologists, interventional radiologists, and neurosurgeons. So we need to now redraw the lines and decide that there isn't one specialty has carte blanche treatment of folks with multiple sclerosis. I want you to think of it now when we talk about chronic cerebrospinal venous insufficiency as a vascular or circulation problem. And if we look at it from that perspective, you'll probably understand it much better. We all know about stroke when it shuts down blood supply to the brain, but if you have relative blockage of veins flowing out from the brain, often with double the pressure they would be ordinarily, then you start to see how that back pressure may be causing injury to the brain, whether it's through iron or relative lack of oxygen to the cells. This is bigger than just multiple sclerosis, but currently multiple sclerosis is the leader as far as the awareness of it and the function. Partly in tribute to Dr. Zamboni and of course his spouse, his wife, with MS. So I had my angioplasty November 29th. It made a profound difference in my ability to think, my energy, but also it returned my bladder to where it was 30 years ago for function. That's a profound difference. I've also noticed an improved control of bowel function. And that is a very special thing when we can restore people's human dignity of both bowel and bladder function. The other thing it's done for me and many others, you'll hear more about it later, is it's eliminated my muscle spasticity or spasm. Mine was moderately well controlled, but many people have to use a lot of drugs and still cannot control it. So when we start to see things that can do that much symptom control, we start to compare it to the relief of chest pain or angina, which initially was the reason we started to use coronary artery bypass grafting and then eventually coronary blood vessel angioplasty. So the angioplasties that are being done now are incredibly safe. And I think we need to compare apples to apples and oranges to oranges. We need the neurologists to move away from their very strong position. Unfortunately, we were polarized immediately by a neurologist stating in Canada that anybody did this interventional procedure for CCSVI was a charlatan or a quack doctor. That's completely unfair. I'm very frustrated and sometimes even embarrassed to be a physician to have a group that would hold all of the physicians in Canada at relative ransom by insisting that they know exactly what to do for people with MS and people with their brain. People are still people. We are the people that make the decisions. We should be the decisions that make the decisions for ourselves, and that has been taken away. In some provinces, the neurologists have convinced the colleges of physicians and surgeons to not allow family doctors to refer people with MS for ultrasound of the neck or to see a vascular surgeon. When did we with MS become second-class citizens? It's time that we had involvement from the people of Canada that represent us. So in closing, I want us to really look at the issue of evidence-based medicine. Probably less than 20% of what we actually do in Western medicine is actually truly evidence-based. This is held up as a hallmark of how we practice in Canada. It's not actually true. Less than 20%. The other issue that the neurologists are doing is skating on very thin ice. Because now, after more than 10 years of study, 3 review trials about the very expensive drugs, $20,000 to $30,000 a year for MS, have shown that they don't work very well, if they work at all. So if we're going to require evidence-based, then we better, be honest and straightforward about it. Just because they feel that the trials work doesn't mean that the reviewers have felt that they actually work. So it's time now to solve this anger issue. More than tens of thousands of people have had this procedure done now. It's extremely safe. People are angry. We're only going to help people solve that anger by getting with the program, starting some clinical trials in Canada. You can do them under the auspices of safety. You can do them under the auspices of trying to see, but also you're going to be helping train the Canadian skills within this system. Please help me move people forward with clinical trials in Canada.